So the country will stay in alert level limbo for another week at least. Next Monday, the Cabinet will reconsider the alert levels, and as long as COVID cases are tracking as they are now, the country outside of Auckland will move to alert level 1 at 11:59pm that same day. The government will consider whether or not to change restrictions around gathering sizes in the super city. Now, if those tweaks are agreed, they will come into force on Wednesday the 23rd. But that means the country could be split across different alert levels, something the Prime Minister has previously advised against. So I asked the all-of-government spokesperson, Grant Robertson, what's changed?
We've got an increasing confidence that we have this outbreak in Auckland under control. We're obviously seeing very small case numbers in the last few days, and as long as we continue to see that, then we've got a level of confidence that we can move the rest of the country to level 1. Obviously, in terms of the Auckland area itself, we want to move cautiously. We would still be asking Aucklanders, as we are now, that when they travel to take their Auckland status with them and make sure they continue to be careful. But our confidence grows. The advice we have is that as long as we can continue to see these case numbers, then we can move the rest of the country to level 1.
Because, and I'm going to read you a quote from the Prime Minister here, on the 24th of August when she was queried about moving the country to 2 different levels, she said, "I absolutely understand the sentiment that sits behind that. It does make sense except for one issue, and it's the one you've just raised, Minister, and that is regional travel. There are many people and businesses who will want to enter and leave Auckland once it is at level 2, and many others will want to see the benefit that comes from our biggest city moving around the country." And she went on to say that that obviously brings risks, and that is why she was keeping some kind of, compatibility between the regions. So you're going against your own advice and thinking, are you not?
No, we're not. I mean, obviously the advice evolves, and as I say, at that point in time, we had larger case numbers, we had less certainty about what the perimeter of this particular outbreak was. We now have the advice that's clear on that. The numbers have been coming down significantly. And look, we've also been seeing fantastic compliance with things like mask wearing on aeroplanes and on public transport and so on. So we know that we can now move forward. Clearly, we'll keep an eye on those case numbers. We'll obviously look to see what we can do in Auckland as well. But as we take the advice, we look at the evidence that's in front of us, and we're confident that we can make this move in a week's time.
So Aucklanders can go down the island and go to a rugby game or a wedding and then travel back to Auckland?
As I say, we continue to give Aucklanders can travel now, as you know, and we continue to give them the advice that they should take their Auckland status with them.
That's only advice, though, isn't it, Minister? And we know from our experience with the Mount Roskill cluster that people do not always follow advice.
They don't. That's absolutely true, and it's the reason why we continue to have some restrictions up in Auckland beyond what we have here now. But we are getting to the point now where we're down to 1 to 0 cases a day. So long as we stay there, we've got the confidence to move forward.
You still don't know how a number of those people caught their infections, though, do you? So there's plenty of missing pieces from the puzzle. How many are there where you've got genomically linked cases, but you don't actually know where the physical contact came from? How many of those have you got still?
Look, there will still be a number, and the issue is we may never know. But bear in mind the alert level framework has been set up so that we can move down the alert levels while there are still cases. The criteria is to make sure that we've got any outbreak under control and we have the ability to stamp out anything that does arise.
But you could still be missing.
We had to be at 0, or we had to have the complete information set in order to move. We've done pretty well with our contact tracing, but yes, you're correct, there isn't an epidemiological link between every single case, but the genomic sequencing we're now doing gives us a lot of confidence that we're dealing with a single outbreak here.
How many subclusters do you not have that physical link for? So you've got the Botany one, you've got Joe Williams. Is there more on top of that?
I'm not aware of any more than beyond that. Obviously, the work with Mount Roskill has led to its own subclusters as well. But as I say, this is the advice we get, Lisa. Neither you nor I are either an epidemiologist or a genomic scientist. What we do know is that the information we have from the genomic sequencing is that this is all linked to the same outbreak. Epidemiologically, that's the work that goes on. But right around the world, we know that we can trust the scientists when they tell us if these clusters are linked together.
Was the Director General entirely happy with removing social distancing on planes and public transport?
It was actually his recommendation, yes.
So it's not to do with the fact that we've got the school holidays looming and a lot of the people in the tourism industry have been agitating for this. Nothing to do with that?
No, in fact it was, as I say, it was his recommendation. I mean, clearly over time the advice in this area has evolved. Originally we were very focused on physical distancing. Then when masks came along, we were told that we needed to keep both of them in play. The compliance with mask use has been excellent, and the Director General's advice has evolved to now say he believes we can move forward. He's worked closely with Air New Zealand around their overall health and safety and making sure that they're doing all of the right things to assure that safety. So this was, in fact, exactly his advice.
So the health worker infected who works at Jet Park, they have been to the gym, right? And obviously there are not the same restrictions on group numbers at the gym. Is this a mistake? Because you now got a whole lot of close contacts at that gym who now have to go into isolation. Is it a mistake?
Lisa, I'm not in receipt of the information to say that it is definitely the person who was the health worker who went to the gym. What I do know about the health worker is obviously there are plenty of rules in place around how they use PPE, what they do inside the facility. We've now got the regular checking, which means that this person tested negative last week and positive this week. And so we have to rely on people to be able to follow those rules within the facilities. But we know internationally that a number of health workers, despite the best efforts, have ended up getting COVID. There's protocols around PPE use, but they're not going to be perfect.
Okay, we can talk a little bit more about that worker shortly. Regardless of who the infected person is at the gym, is it wrong not to have limitations on numbers at gyms, given the situation we now see ourselves in? Because as we know from people who are epidemiologists, that it is the perfect environment for spreading viruses.
And those gyms have very significant criteria and protocols that they have to meet. So it's not unrestricted in terms of the numbers of people who go there. And gyms, and there are many other environments, not just gyms, where it's possible.
So is a gym class a gathering? Is there a limit on 10 people in a gym class? Is it a gathering?
So they need to be, my understanding, Lisa, is they need to be in bubbles within a gym class. There can be more than 10 people in the class, but that's similar to having more than 10 people in other types of environments like bars and restaurants and so on as well. And so those rules are in place. They've worked well. This is not a suggestion that someone got infected at the gym. It's a suggestion that they went there. They have close contacts. We're now chasing up the close contacts. It's exactly what we do in all of the cases.
It's about the environment in which it can spread, though, isn't it? Because the other place is swimming pools, where we're having reports, again, where there are people cheek to jowl at swimming pool events with kids' swimming lessons. And also, if you've had a wander on Ponsonby Road of an evening, if you've been up there this Saturday, it's absolutely heaving. People are clearly not following social distancing in many cases, aren't they?
Well, I think those who are running facilities, be they gyms or bars or restaurants, know what their obligations are. And there has to be a certain sense of personal responsibility here. You know, we're asking people to take particular precautions to help ensure we don't see spread of the virus. And we can only all do our best to make sure that we comply by physical distancing. It isn't always completely easy or completely possible, but we're just asking New Zealanders to take a bit of personal responsibility alongside all of the other rules that we have.
In respect of the healthcare worker who is infected, so that's been genomically linked to the Auckland cluster, and we know that obviously people from the Auckland cluster are in that quarantine hotel. What contact did this person have with those people infected with this particular strain?
So that's been looked into at the moment. We're reviewing the staff logs, the swipe card data, the CCTV footage to map the person's movements so that we can understand exactly who they came into contact with and make sure that, we understand that. All the staff are being retested. The people working in these facilities are our front line against the virus, and so from time to time they will come into contact with it. And as I said, overseas we have seen cases like this emerge. We just have to keep sticking to the protocols there.
So as yet you haven't identified direct contact? As yet you haven't identified direct contact with those cases?
No, that's what's been worked through at the moment.
Is there a fault in the system here? Because this person was picked up during routine testing, weren't they?
Yes, they were.
Okay, so every day they have a health check, don't they? Where they clock in and say whether they've got any symptoms or they're feeling unwell. So this person obviously had a test the week before and a test this week, and at no point felt unwell. So could have been infected for a few days going to work.
I mean, that is potentially possible, but we do the testing weekly. That's a sensible protocol. It's not really possible to test people every single day. That's why we do the health checks. This is actually an example of the system working, because the person did test negative last week. We've now given them another test and they tested positive. That's exactly what we're trying to pick up here. The system then kicks into gear. We follow up with all of those people who work around them. They're being retested. We take a look at all of the CCTV footage so we can see who they've interacted with, where they've been, and that'll build the picture up for us of whether they have had any contact with somebody who is from the existing cluster. So it's actually the system working. It's never, ever going to be 100%. Internationally, we know that. This is the front line against the virus, and it will happen from time to time.
A lack of symptoms is the real problem, isn't it, Minister, when you put the country at two different alert levels? You could have someone leaving Auckland who's not immediately symptomatic, going to a large gathering down the line and then becoming a super spreader and heading back to Auckland. That is the risk you faced with the prospect of putting the country into two different levels next week, isn't it?
Yeah, well, what this requires is the whole system to work well. So we need to be testing plenty of people.
And there are no guarantees it will, are there?
Well, there's no guarantees in life, Lisa, but we're doing our very best to have a system where we test as many people as possible. We've got good contact tracing, that people follow the rules about washing their hands, physical distancing, wearing masks. All of those things put together mean that we've had very limited number of cases in recent days. We're doing well here, and we can make sure that we can build on the gains we've made if everybody does stick to those rules.
Can you put your Sports Minister's hat on for a second and just tell me if you've got any sympathy for the Wallabies who are complaining about the quarantine restrictions affecting their training prospects?
Look, I mean, we're working with New Zealand Rugby to make sure that we can get, both teams to be in the best state possible when it comes to playing these games. Obviously, the Australian team have been playing in their equivalent of the Super Rugby competition, so they must be fairly match fit, I would have thought. But we'll keep working with New Zealand Rugby and them to give them the best possible chance to be at the peak of their form when they come to play here.
And that was Grant Robertson ending that interview with his Sports Minister hat on. Before that, he was the all-of-government spokesperson.